hospitalization numbers will be important to watch as our economy reopens. We've been seeing a steady drop over the last 2 weeks. A week ago, there were 782 people in hospitals. As we mentioned, that is down to 650 today. These numbers helped influence Denver's decision to reopen.
Hospital admissions are as low in the last couple of weeks as they were in the beginning of this, which I think is testimony to the fact that Denver got out in front early on this.
Jamie Leary has been checking on the hospital system and joins us from Lakewood tonight. Jamie, noticing hospital capacity is crucial as things get back to normal.
And no matter which hospital we visit, health experts continue to stress that our health and our economy are tied together. So we decided to check in with one of the first hospitals we visited when this all began, one of the first to give us a look inside at its surge protection plan. And we wanted to find out whether its top doc believed that they were ready for a safer at-home order.
We were prepared to make difficult decisions. We have a triage committee standing, and we are privileged that we never had to utilize it.
Over a month ago, we saw the Medical Center of Aurora set up triage tents. Like other hospitals, they haven't been needed.
Because we never ran out of beds, of ventilators, or of protective personal equipment.
Dr. Phil Stahill is the chief medical officer here. He says his hospital is ready for safer at home.
At this point in time, it's imperative to allow patients to come back to seek medical care.
They have the space because they're seeing fewer patients hospitalized for COVID.
We have treated hundreds of COVID-positive patients that were safely discharged home.
The number of COVID cases here specifically have gone from 100 in the last few weeks to less than 60. And outside of these walls, efforts by cities to track down asymptomatic people through contact tracing could help even more.
I think what the CDC recommends with contact tracing is extremely important out there in the community in terms of understanding who is at risk, because there's still many asymptomatic virus shedders.
Dr. Stahill became chief medical officer here in February. Well, it's been a surreal experience. He says efforts made by people inside and outside the hospital are working.
I'm truly proud to be a servant of our community here in Aurora, Arapahoe County, and way beyond.
And he stresses again, it's important to continue to practice social distancing. And while it's safe to do elective surgeries, go into some businesses, and eventually restaurants, he believes that these will be practices and measures we'll have to keep in place for the foreseeable future, at least until there's a vaccine. Live in Lakewood, Jamie Leary covering Colorado First.